Topic of the lecture today is mumps. Now, mumps is a very odd word for given to a disease. It actually came from two different words. There are different theories that where this word came from. Some people consider that the word mumps came from the word mumbled speech or mumbling. Now, if you know a little bit about mumps, it's actually inflammation of your salivary glands, and in most of the cases, parotid glands. Now, if your salivary glands are inflamed or going through some pathology, you might have a mumbled speech because you won't be able to pronunciate everything properly. There will be something wrong with your pronunciation. There will be something wrong with your delivering the words. So, other person which is normal salivary gland, which has no sign of mumps or no inflammation of salivary glands, might feel that you're mumbling in your mouth and you're not talking properly. That's where this word came from, this word mumps, from mumbled speech. On the other hand, you might see a lot of patients who are presenting to you with mumps but don't have any mumbled speech. They will be talking normally. So that's why most of the people think that this word didn't come from mumbled speech. This word, this mumps, came from actually the word lumps, because when you are having this pathology, you get this inflammation of your parotid glands in most of the cases. So you get two lumps on both sides of your jaw and under your ear at the very start of your neck. So that's where they think this word came from. So these two origins, I told you, these two origins of this name, the word lumps and the word mumbled speech, that might contribute to the name of mumps today. Now let's talk about mumps. What is mumps? So mumps is actually an acute viral infection. An acute viral infection which is caused by Paramyxovirus. Now, an acute viral infection caused by Paramyxovirus will not be very quick to get in your body and cause these pathologies. Their primary target organ is your parotid glands. They come in and attack your salivary glands, but basically, in most of the cases, it affects your parotid gland. That's why the second name given to mumps. Mumps, I told you, it has two origins, mumbled speech. On the other hand, we have that lumps theory. But what is a medical name for mumps? What is the medical name for mumps? That's where the second name, or the name that is referred to parotid gland, comes in. The word infectious perotitis, you must have heard it up till now. The second name for mumps is infectious perotitis. Why? Because it leads to infection, number one. Number two, it involves your parotid glands. As you can see, your parotid glands are involved, and that's where this word comes from, infectious perotitis. So your parotid glands in most of the cases are involved in these scenarios. Patients might present to you with these pathologies which have unilateral parotid gland inflammation. Yes, that happens. That's rare, but that happens. In rare cases, only one side of the parotid gland is affected and the other side of the parotid gland is not affected yet. But if you don't do anything, if you don't intervene, it will lead to the swelling of the other gland too. But whenever the patient will present to you, most common presentation will be inflammation and swelling of both the parotid glands. Now, this image, as you can see, just look at this image and you will see that parotid glands are situated right behind your jaw and below your ear, right? So when they're inflamed, they'll give you what kind of look? They'll give you chipmunk look. That's what it's referred to in medical terms. This look on your face, it's referred to as chipmunk face, because your face is all squared up. That's where this word comes from. So it's an acute viral illness which is caused by Paramyxovirus. Now, what is Paramyxovirus? It is a single-stranded RNA virus. Single-stranded RNA virus which will get inside your body, replicate itself, and cause pathologies. It does not contain any double-stranded RNAs or DNAs. No, it's just a single-stranded RNA. And our body responds to it well. our body responds to it by producing antibodies or by producing defensive mechanisms against two surface antigens of this virus. Those two surface antigens are surface antigen S and surface antigen V. Now these two antigens are the antigens against which our body modifies its defense system, acts on it, kills these viruses in the body. Before the advent of the vaccine, which is given in the patients of mumps, before they get the mumps, obviously, because it's very useless if you give them to the patient which is already suffering. Which vaccine is given? MMR, right? So MMR vaccine is given to only those patients which have higher chances of getting this pathology. Now, when is MMR given? MMR is given at the age of 12 months in some cases, and some people give it at the age of 6 months. Why? Why not give them immediately after birth? Because when a baby boy or baby girl is born, they contain the antibodies to this pathology. They contain the antibodies to this mumps through their mother. They have inherited it. For at least a year, they won't get this pathology. There won't be many instances or cases in which you'll see a pathology of a child which is suffering from mumps and the age is 2 months or 3 months. No, you won't see that, because antibodies from the mother will come to the rescue and won't have this pathology caused in the child. On the other hand, when you get to the age of 12 months, those antibodies start going away. That's when you need the shot of MMR. Now, MMR stands for mumps, measles, rubella, right? These three pathologies that you give the treatment for. Now, as a single-stranded RNA and vaccine was developed in 1900s, before that, many of the soldiers got this pathology from one another. It's very contagious. So, endemic and pandemic and epidemics will happen in different regions because of this pathology. Most of the epidemics happened in the military camps because they didn't know what to do. And if this pathology, this might seem very casual to you these days because we have produced vaccines against it, we have produced different kind of treatments against it. But if it were to happen before the vaccine was invented, this will go on and lead to very devastating conditions. And what devastating condition would that be? Now, this parotitis, this infectious parotitis may go up to your brain and cause what? Inflammation of the brain, called what? Encephalitis. This can go down to your testes and cause what? Orchitis. And in many of the cases causes sterility. Now I think you get the image how serious this pathology is. So the advent of vaccine has obviously helped us a lot in combating this pathology. So keeping in mind that it's a single-stranded RNA, it's a Paramyxovirus which gets in our body and causes these pathologies. Let's move forward with how it causes that pathology, how it gets inside our system, how it propagates, how it navigates our body to cause different pathologies. First of all, let me give you a very depiction of Paramyxovirus. Here comes the Paramyxovirus. I told you it's a single-stranded RNA virus which is present in the human body, which is suffering from this pathology, which is suffering from mumps. You might see this virus in a healthy person as well, but he won't get any kind of infectious swellings or problems with the salivary glands because that person already has the antibodies to it. That person already has a combat to it. So that person won't have any pathology, won't have any problem killing it off. But if the person is not vaccinated, then this pathology is going to sustain itself. This pathology is going to cause infectious parotitis. This pathology can cause infection of the other salivary glands. This organism can cause severe manifestations regarding your brain, regarding your GIT system, regarding your testicle torsions. It can also lead up to the meningitis level. It can cause death, but rare cases have been seen in which the person died because of it. But these drastic manifestations obviously leave very dramatic consequences afterwards if you even don't die. So let's talk about the epidemiology of this pathology, epidemiology of this organism. So as you can see, these are the regions which are depicted here, right? Now these regions are given as B, C, D, F, G, H, I, J, K for your convenience, for your understanding. Now as you can see, these areas which are notated as G have been through the most, have been suffering it through the most. In the developing countries, it's still a problem. If you see all the developing countries here, which are basically Asian countries, South Asian countries, South American countries, they still get affected by this pathology because still they have not been able to procure it. Still they have not been able to vaccinate every person that is born in the country. And once a person gets it, it's not too late or it's not too much that the other person will get it in no time. So those areas in which the population is too much or the population is high and they are developing countries, they get this pathology very often. This chart is very evident of that regarding these circled areas. Let's talk about pathogenesis now. We know that up till now, we know that it's an RNA virus. It's Paramyxovirus. It causes swelling of our salivary glands, basically causes swelling of our parotid glands. Now, how does it do that? How does it cause that? This is a normal person, for example, this is a normal person which is going to get infected by this pathogen, What's going to happen? First of all, let me tell you the incubation period is between 5 to 20 days, 5 to 14 days, and after 14 or 15 days, you start getting those symptoms of the disease. So the incubation period varies from 5 to 14 days. It can be lesser than that. It can be greater than that. It's not a pet thing, but in most of the cases that we have observed in medical researches, that this incubation period varies from 5 to 14 days. Afterwards, the symptoms come in. So what happens is that the entry into respiratory tract happens. So route of transmission is through your respiratory tract, through your nose, through your mouth, to go into your respiratory tract. Where will it come from? From an already infected individual. From an already infected individual, it will come from through what? Through contact, through sneezing, through coming out to you, through touching, through sharing meals, through sharing the same utensils. All of these things combined, it will come to you. And for example, your wife has this pathology and you are having an intercourse with her, or you are sharing your saliva with her, you are definitely going to get this pathology. So all of these are risk factors that which people are more prone to getting this disease. And if you summarize them together, there's only one line that can explain everything. And that one line is that if you get in contact with someone who is already suffering from this pathology, you are definitely going to get it. Or if you're vaccinated, you won't. So what happens is that you got in contact with that person. The person that was suffering, you got in contact with that through your touch, through your food, through your water supply, or you share the same utensils, same glass, same food, or something like that. Or if you share the saliva with that patient, you are going to get this pathogen into your respiratory tract. That's clear up till now, right? So it entered into your respiratory tract. What happens afterwards? It goes into your local lymph nodes. When? In most of the cases, let me tell you, it doesn't just go directly to your lymph nodes. No, it does not. It's just written here so that you can remember just 3 to 4 key points, 3 to 4 flash points for your examination. But what happens is that you get the entry basically in your nasal mucosa, in your nostrils. When you get this entry, they move up ahead in your nostrils and they start growing there. They start multiplicating there. Nasopharynx is used for this purpose only. So they get there, they get to your nostrils, they go in, they get to nasopharynx and replicate there. When they replicate and they get to certain amount and they get to certain number that they can cause this pathology now. Only one strain or only one virus won't be able to do it. It needs a lot of viruses. So it will replicate in your nasopharynx. After replication and after reaching a certain limit, a certain number, a certain amount, it will go up, go down your throat and start causing pathologies in your local lymph nodes. That's what this is about. It will spread to your local lymph nodes and do what? And spread to distant lymph nodes and spleen. Because after infecting your local lymph nodes, they are free to roam around your whole body. They have gone into your lymph nodes, they have got entry into your lymph nodes, they better use it. They go on and infect the other lymph nodes which are not so close to that infective origin, which are not so close. They go on and infect the distant lymph nodes, they go on and infect the spleen, and afterwards, what do you think will happen? They got there, they get to your lymph nodes, they got to distant lymph nodes, they got to spleen. Now, with the word spleen comes what? Blood. So from there, viremia will happen. Viremia is what? Presence of virus in the blood. That's what viremia is about. So they'll go into the blood, they will have this hematogenous spread, they'll go to the blood and start causing this infection. Now this blood takes it everywhere. Once anything is in the blood, it has gained entry to virtually everywhere in the body. They can go up to your brain, cause inflammation, cause meningitis, cause encephalitis. They can go up to your testicular area, cause torsion. They can go up to anywhere and cause the pathology is there. They can go up to spleen and cause the splenic problems there. So once they have gained entry into the blood, they can virtually do anything in the body. And as we see the spectrum of their pathologies, we understand that, okay, the spectrum is not so short. They can affect many tissues, many organs, and cause different kind of pathological consequences. So after viremia, what happens is that generalized spread to salivary and the glands and to the other body sites. Now, once they are in the blood, now they'll move up to everywhere. And what's the favorite site to infect? Favorite site to affect? Your salivary glands. With the blood, they'll come to your salivary glands and cause this pathology there and cause the inflammation. And in most of the cases, like 90% of the cases, which salivary gland is that? Parotid salivary glands. Other salivary glands might get involved, but in most of the cases we see is parotid gland being involved in the most of the cases. Now, most of the students think that, okay, we have this mumps, okay, virus must have got and infected this right here, infected these body sites or infected these glands right here. No, it does not work like that. Even I, as a doctor, as a medical student, thought like that. But what happens is that they gain entry into your respiratory tract, they multiply there, they get to a certain amount, they go to your local lymph nodes, they infect them, affect them, and after infecting and affecting them and might after reproducing them, they go up to your distant lymph nodes, they go up to your spleen, and once they're in the spleen, that's the site for the blood. They go up to the blood, they go for the hematogenous spread, the viremia happens, virus is present in the blood, then viremia will lead to what? Viremia will lead to the blood going everywhere. Generalized spread will happen. Now this generalized spread, we have studied again and again. The favorite site of virus for this virus is our salivary glands. So that blood will take these viruses to the salivary glands and they will cause pathologies in your parotid glands, and your other salivary glands might get affected in these cases. So that's all about pathogenesis of it. Now, a very important question which is asked in the board examination is what? The most important question is that if a person is suffering from this pathology, already which person is going to get this disease. What is the infective period? What is infective period? Now, infective period is that period in which you can get this disease from that person. A person who is suffering, you can get this disease from him. Now, that's what infective period is. Now, let me tell you, infective period contains 15 days. It's a set of 15 days. If you are in contact with that person in those 15 days, you are going to get this pathology. 9 days prior to getting this inflammation of the parotid glands or inflammation of the salivary glands, you can get this pathology. That person won't even know it, that he has mumps, and you will be sitting right with him, sharing the lunch, sharing the dinner, or even if he's your husband or wife, sharing everything. You won't even know that this patient is suffering from mumps, and you will share everything and you will get the mumps from him. So, in the incubation period, in the incubation period between 5 to 14 days, this incubation period is also infective period in which you can get this pathology from that person, because in these days, what's happening? In these days, viruses are replicating like anything. And they are right in your nostrils when you're sneezing, when you're coughing, they're coming out. They can infect any person in their way if it's not vaccinated. Now, you might be thinking, okay, when we have got the swelling, then what? When you've got the swelling, after that, other 6 days are also infective. It means 9 days prior to getting those inflammations and 6 days after getting those inflammations, you are infective. You have to stay out of the reach for those people who are not vaccinated. So you have 15 days of infective period in which 9 days are prior to getting the inflammation and 6 days after getting the inflammation. That's what infectivity period for mumps is. I hope that's enough for pathogenesis. Let's move on for the clinical manifestations. Now, what clinical manifestations this patient will be presenting to you with? You might recall, you might think of all those patients which did present to you with mumps. And you might think, okay, this patient had all these clinical manifestations. If you keep that in mind, it's very easy. Just look at that chipmunk face I told you about, and you will have it. First clinical manifestation will be what? Inflammation of the parotid glands. Some cases unilateral, in most of the cases bilateral. Mumbled speech. Now these are very obvious clinical symptoms. You might not even have to think about them to get to them. So this clinical manifestation depends upon the progression of the disease. These two are very early symptoms. But how the disease progresses through its time period, what clinical manifestations it comes along. So first of all, let's talk about what and how it's progressing and what and how it's transmitting, right? So first of all, we have prodromal stage, we have early acute stage, and we have established acute stage. I told you it's an acute respiratory infection. The acute respiratory infection, it means it won't go chronic. And even if it does, it has very devastating conditions. But in 99% of the cases, it stays acute because our body responds to it one way or another. So what happens in the prodromal stage? What clinical manifestations will happen in the prodromal stage? In which this patient has been just, in this stage, the patient has just been exposed to this pathogen. This patient is not vaccinated. What clinical symptoms he'll get very early? First symptoms that he might present to you with are headache. You might think headache can be caused by anything. Malaise, myalgias, and fever. Fever, why? Because now the viruses are replicating. They're going to the blood. They're causing viremia. And when there's viremia, our body will respond to it very strongly, cause this fever to combat this pathogen, and this will go on. Myalgias, because of this pathogen. Malaise, because you have fever, you have myalgias, you are definitely going to have malaise. And headache, because of its clinical manifestations. So you got these 4 symptoms at prodromal stage. What will happen in the early acute stage? Now it's not in the it's not in the incubation period anymore. Now it's established. Now it's establishing. What clinical symptoms will come afterwards? Other clinical symptoms that will be coming are meningitis and parotitis. Parotitis being these parotid glands being inflamed, and meningitis being meningeal layers being inflamed. Now, up till this point, viremia happened, but it didn't cause any systemic pathologies. It was prodromal stage. Viruses got entry, our systems got active, they tried to combat to it, and you got all these pathologies, which are headache, malaise, myalgias, and fever. Now viremia happened, and it is going to where? It is going everywhere. Generalized distribution of the blood is happening. So it's going everywhere. If it goes to your parotid glands and the salivary glands, it inflames them, and that's what parotitis is for. And if it goes up to your brain and goes to your meningeal layers, it's going to inflame them and cause meningitis there. Now, it was an early acute stage. What is established acute stage? It means that you now know that you're suffering from this pathology, you have these inflammations coming off, you want to consult a doctor now, but you know that this infection is there in the body and this is an established infection. It's not going anywhere until you do something about it. That's what established infection is. Now, what clinical symptoms will be coming with established infections? Now, it will contain all of these symptoms beforehand. It will have headache, it will have malaise, it will have myalgias, it will have fever, it will have viremia, it will have meningitis, parotitis, and then what? Afterwards, what? Afterwards, it will have encephalitis, which is a viral infection. Now, encephalitis, which will lead to deafness, it will lead to pancreatitis. So, these established acute clinical manifestations are rather very drastic, right? So, it goes up to your brain, it's already causing meningitis, it may cause encephalitis. Because it's a single-stranded RNA, it might cause that. Then it can go up to your, from this parotid gland, it's not so high your ears, are they? No. They'll go up to your ears, your ear canals, and they'll cause deafness. Afterwards, it will go up to your testicular area, cause torsion there. Then it will go up to your pancreas and cause pancreatitis there. And that pancreatitis will also be acute pancreatitis. Now, these are very important clinical features. Most of the patients don't get to this established acute stage. They go to the clinical physician or clinical practitioner when they get these symptoms of parotid gland swelling. So you don't have to take it very lightly. Once a person gets this symptom, signs, all these we discussed, he should definitely go to a consultant and talk about it and get relieved. Otherwise, this established acute infection can lead to encephalitis, meningitis, deafness, pancreatitis, orchitis, and viuria. What is viuria? Virus is coming out of your urine. That's what viuria is. So we have established the clinical manifestations, right? We have established that in the first stage of prodromal, still there's no viremia. In the very start, I told you viremia happens in this stage. I'm very sorry, it doesn't happen in this stage. What happens is that they just got entry to your system and your body is trying to combat those organisms. It's not in the blood yet. It's in the lymph nodes yet. It's replicating there. It's going to distant lymph node. It's going to spleen. In the second stage or at the acute stage, there goes the blood. There viremia happens and then goes on into meningitis, parotitis, headache, malaise, myalgias, fever. And then if you don't do anything about it, after getting the parotitis, you're definitely going to do what? Either your body is going to respond with what? We talked about it. 2 surface antigens are the antigens against which our body responds, or against which our body will produce different kind of antibodies. S and V. Those antigens are the ones our body targets. So either our body will respond very strongly and remove this infection from ever happening to that person, or our body is somehow immunocompromised and we didn't know about it, or even if we knew about it, our body was immunocompromised and it went on to the established acute stage in which you'll get what? Viuria, orchitis, encephalitis, deafness, pancreatitis, all these clinical features will be coming on then. Now let's talk about the differential diagnosis. If a patient comes to you with meningitis or orchitis or all these pathology we just talked about, all these clinical features, they are actually your differential diagnosis as well. What other differential diagnosis is to consider? First of all, other causes of parotitis. That's very simple, right? Next of all, testicular torsion. Because in testicular torsion, the patient will be presenting to you with severe testicular pain, and it's a surgical emergency. You have to relieve that immediately. It's one of those differential diagnoses. Or aseptic meningitis. Maybe you got meningitis from other source, from aseptic, you got meningitis because of aseptic meningitis, not because of viral meningitis. Right? So you have these differential diagnoses, but what will they do for you if you don't go for history or examination? History, examination, and then testing for this virus will lead us to our confirmed diagnosis. Aseptic meningitis can happen on its own. It doesn't need this mumps to come in. Testicular torsion can happen on its own. It doesn't need mumps. Other causes of parotitis can happen on their own. Pancreatitis can happen on its own. So all these clinical features we talked about, they can happen on their own. Maybe the patient presents to you with testicular torsion and you think like, okay, he has mumps. No, they can happen on their own. First, you have to rule out that it's not that immediate problem. It's not the only testicular torsion we are dealing. Once you've ruled out that, then you go for the treatment modalities. Now let's talk about what will you do as laboratory manifestation. Before you head on to laboratory manifestation, one thing I keep ensuring that I deliver in every lecture is that you have to tell about the history and the examination. Once a patient presents to you with this pathology, with its headache, malaise, fever, myalgias, these will be the first symptoms, right, in the prodromal stage. These will be the first symptoms to come in. So a patient presents to you with this pathology, you will start with the history. Okay, what's your name? Where do you come from? Then if he says that I'm having all these problems, your mind will ultimately go to 5 or 4 different kind of differential diagnosis. Meningitis hasn't happened yet, so meningitis is not a differential diagnosis in this case. So you'll ask about his birth history. Start from very early. Birth history. That was you or were you vaccinated? If he says yes, then there's no problem because vaccine can take care of you for 10 years or more. If he wasn't vaccinated, you get this ultimately that, okay, you're not vaccinated, you might have this pathology. Start from the history. Okay, if he goes on like, okay, I was not vaccinated or I was vaccinated, but it has been very long, then you ask about his personal contacts. His contacts. Have you ever been in contact with such person who is suffering from mumps or measles or all those contagious diseases? Have you been in contact with such a person who maybe you didn't know that he's suffering from this pathology, but now you know, because we talked about the infectivity period starts at the 4th day of incubation period. So you'll ask about all those important questions and you'll go for the examination. You'll go for the parotid gland examination in which you'll know that, okay, they are being inflamed. Either both sides are involved or one side is involved. Then you go on and examine the lymph nodes, local lymph nodes, because the lymph nodes are being infected and affected at the very early stage. So you might you have a chance of getting to this pathology very early by examining the lymph nodes. Next on, you go for the laboratory diagnosis, in which you'll go for the blood complete picture, in which you'll go for all those important tests which are very basic. After doing the basic testing and kind of getting to the progression of the disease, you go for these tests which confirm the diagnosis, and they are PCR and they are immunofluorescence staining. They confirm your diagnosis of the presence of this virus in your body. And once they have confirmed your diagnosis, you go for the ultimate treatment options. Now, what are those ultimate treatment options? Now, in this slide, in this treatment option, we're talking about only those patients who were either not vaccinated or who were vaccinated, but it has been a very long time and somehow they got immunocompromised or some problem happened and they got this pathology again. Now that the patient has this pathology, you can't go for vaccination. Vaccination is done only either prior to this pathology or afterwards to this pathology, so that person doesn't get this pathology again. It doesn't happen during the pathology. Vaccination cannot be done during the pathology because it won't have any effect. So the treatment options are for those patients who are right now suffering from this pathology. Now, a patient has presented to you with all that history we talked about, with all those clinical manifestations we talked about. The treatment that you are going to give to that person is going to be what? Is totally dependent upon the clinical manifestations of the patient. If the patient is just having these headaches and myalgias, you won't give much. If the patient is having meningitis, now that's something to give. That's something to prescribe a lot of medicines and ask him to shift to ICU, because meningitis is not a very easy condition. Meningitis leads to scars. So what happens is that the treatment options we will have will be totally dependent upon the clinical manifestations with which the patient has presented to us. Now, what treatment option we have for a normal person? What treatment option will we give to every patient which comes with mumps? First of all, you'll go with analgesics. Now, analgesics will relieve the pain. They will relieve this discomfort of having the pain. Next on, you'll go for the warm or cold compresses. Both are effective. Next on, you'll go for the cold compresses and gentle support for scrotum. Now, scrotum is being involved in what cases? In which orchitis is happening, in which there's some problem with the testes, or torsion is happening in some cases. Now you'll go for the cold compresses and gentle support for the scrotum. And next on, you'll go for the anesthetic block. Now, anesthetic block is what? You block their nerve supply. You numb those sensations of pain. That's what anesthetic blocks is. You numb those sensations and the patient feels like this pain went away. Now, these four are the treatment manifestations that we use in every case. Not in every case, you won't go for anesthetic block in every case, but other three, yeah, you go for them in every mumps case. But the real treatment, the treatment that should be given, depends totally upon the patient that has presented to you, the clinical manifestations he has presented to you with. Either it's sterility, you go for that. If it's he's getting deaf, you go for that. If he's having these problems with pancreas, you go for their treatment. You refer them to their doctors. But the treatment totally depends upon the clinical manifestations. Now, let's talk about the preventive methods or prevention. Now, maybe the person has not yet gotten this pathology. I'm talking about both groups of people, that either they got this disease, now they're fine and they don't want to get this disease. Number two, they didn't get this disease and they're too frightened to get this disease. It's for those people, these preventive methods. Only preventive method we have is the vaccine, which is called MMR vaccine. Now, MMR vaccine is the best preventive method we have. After that, what else to do? What else to do is don't share things that have saliva on them, like glass of water, like bottle, like your food which you were eating, and then you give it off to a person which is not suffering from this pathology, but eventually is gonna. Next on, cover your coughs and sneezes, because that's where the viruses come running out of your nose and mouth and infect the other person which is sitting right next to you. Stay home when you're sick, because if you go out and you sneeze and you cough and you share food, there's going to be multiple people being in contact with you, and all of those people will be sick afterwards. Go wash your hands often with soap and water, because if you have such a contagion on your hands, if you have such a virus on your hand, you have to wash your hands so that you might get a chance to get them away from you. Clean and disinfect surfaces. Specifically, it's for those people which are serving in medical institutions like hospitals. They get mumps patients every day or every week. So a patient of mumps came to you and he sneezed and he coughed. Okay, you had those covers up on the bedsides, but what? That bed is going to have that virus. If the second patient comes in and just sleeps on it, he's going to get the mumps. So once this patient has left, you go for the cleaning and disinfectation process. You clean them properly. And MMR vaccination is very important for the doctors and nurses and workers in the hospital who work often with these kind of patients, that they don't get this pathology again. If they're just slightly immunocompromised, they're going to get this pathology. So they need to get vaccinated very oftenly. Specifically, when you start working in a hospital, you should get this vaccination done. So these are the preventive methods that you have to do. And if you just follow them properly, then there's very little chance that you get this pathology. And even if you think that you cannot do all of this, just go on and get your vaccination done. So that's all for today regarding mumps. We talked about what it is, what is it caused by, how its pathogenesis go, what clinical manifestations come with different stages of the pathology, how do we combat it with diagnostic modalities, and what do we do for the treatment options, and how do we prevent it. Thank you for watching sqadia.com.